All right, thank you for staying with Daybreak. Let's get into that conversation, because what you're seeing behind you is a cancer tag, and apparently it is a lifestyle disease as well. Dr. Jaydeep Pechpalep, Director and Head of Department at Bariatric and Minimal Access Surgery at the Nanavati Super Speciality Hospital in India. Thank you for making time for us.
Thank you very much.
It's a very long intro. And Dr. Roslyn Ngugi, a diabetologist and lecturer at Mount Kenya University. Asante sana for coming in.
Thank you for having me.
And I'll start with you, Dr. Jaydeep. Is cancer on the rise, or are we better at diagnosing it now? Why are we seeing this rise in cases of cancer today?
So I think there are two sides of the same coin. Yeah. The cancer incidence is also on the rise, and at the same time we have far better diagnostic modalities available today to pick them up much earlier, as against what we could do 20 years back. So both of these things are very true, but more than anything, I think the cancer is definitely on the rise because of the phenomenal change or shift in our lifestyle.
Shift in our lifestyle. What do you mean by that?
So when I say shift in our lifestyle, just probably 2 decades ago, we still were active, we still were having a very simple lifestyle, we would still be going out and doing things physically, whereas today, in my country, in India, and probably also in Kenya, that I've been seeing the last couple of visits that I've come to your country, everything is app-based, everything is coming to your doorstep. You're not really struggling to go and do stuff. You're picking up processed food to eat. Everything is ready to eat. You're not really going and cooking. What we used to do back in the days, 2 decades ago, what you still do in your villages, in your native places, where your grandparents are living, all those things are still physical efforts which a human being is taking. There is no sedentary lifestyle like in the cities today. And the food that you're eating especially is cooked food in your hometown, but when you come to the city, you don't have time to cook. So you take anything off the rack and just start eating it. Those are processed foods. Those are ready to eat junk foods. That's what is changing your lifestyle completely. That's not what your system is used to. That's not what your GI tract is used to. That's what is causing the shift in the genes and a mutation in the genes. That's called a thrifty gene theory. That's what causes cancers today.
Okay. And Dr. Roslyn, many people are wondering, everything is wrong. I mean, you're told don't eat meat, don't take too much sugar. So what are we supposed to eat then?
All we are saying is, we know that lifestyle diseases are causing, it's literally a ticking time bomb. When we talk about obesity, diabetes, high blood pressure, it's all linked. So what we are saying is, you can eat anything, but in moderation. How hard is it to just exercise 30 minutes a day for 5 days a week? You know, the problem is, it's interesting, the more advanced and the more developed we are, the less we are doing, the less exercise, the more we are leaving it to our nannies, our drivers take us everywhere, vending machines. It's very easy to just walk into a fast food and your food is ready in 10 minutes time, as opposed to go to the market and pick up. What we are saying is focus on your vegetables. You can still eat your meat, but in moderation. I had a patient yesterday who came and said, okay, I was told not to eat red meat. So what I do is the whole week I eat vegetables. And then I go on Saturday and I eat half a goat. You see, that's the problem. The whole idea is everything in moderation. We're not saying no, no, no. We're saying moderation, moderation, moderation. So what we are saying is this. You have an obese patient. This patient is predisposed to getting cancer simply because you're producing inflammatory markers that actually change that genetic program. So if you have the genetic marker in your family, you're already predisposed. So instead of waiting till you actually get cancer, how about we actually prevent it? How many today have actually drunk just a glass of water? How many have actually exercised 7 minutes? You know, in as much as we are saying technology is actually making things worse, there's a flip side to technology. There are all these apps. If you just check your smartphone right now, there are 7-minute, workouts, 4-minute workouts. Make use of it, especially for the busy executives. For the elderly patients, we're telling them, build parks, walk around, make sure you actually take the time. But I think the problem is, even at the grassroots, our children are no longer going to play in the parks because that's where all the development is. How about instead of playing with your PlayStation, taking mommy's or daddy's phone and playing with all these games, go outside and play football with your child. Actually teach them. You remember a game like hopscotch and all those other games that you used to play when you were a child, when was the last time you actually did any of that? So we are saying diet, exercise, and by the time you're coming to me, don't worry, not all is lost. But everything works together. In as much as in the end, I'm going to send to the bariatric surgeon if, you know, the BMI is uncontrollable and we actually want to come back to, say, your size. You know, we might actually be looking at you, but you could be obese. Simply because of just various markers. You may look, yes. When you look at you, you'd think perhaps in relation to me, that you're actually healthier, but you'd be surprised. If I was actually to check your lipid, your cholesterol, mine would be better because I watch what I eat, I exercise. What time did you come into work? And what time do you actually leave? So what we are saying is, yes, you have to earn a living. But how about setting aside time to actually work? Work out, make your body healthy. So that even if you're predisposed to this cancer, you can actually reverse that process. You can reverse any lifestyle disease, whether it's diabetes or hypertension, diet, exercise, before you come to the medicine.
That is the main concern there, because many people are saying that we are all almost predisposed to cancer. We all have these cancerous cells, but now we're seeing that they're being triggered much faster.
That's correct.
And what is causing all that?
Environment.
So again, what the doctor was saying is that the kind of lifestyle and the food that we are eating is actually triggering the change in our body. So the more colas, sugars, processed foods that we are consuming is what is causing confusion in our GI tract. That's what is causing the change or the genetic mutation which causes the cancerous genes or the cancerous cells to start multiplying. Okay, already you have a preponderance. So suppose there is a family and there is a lady who's got at least 2 other people who suffer from breast cancer in their family earlier. She's going to be at a much higher risk of developing breast cancer in her lifetime. Okay, but the same lady, if she becomes morbidly obese meaning her BMI goes over 35 kilogram per meter square, the same risk for her increases by 18 to 20% directly. Okay, so that's what you're talking about, to increase the risk by 18 to 20% just because of morbid obesity, or preventing it completely by reversing all these things, by coming to a healthy lifestyle, as she was mentioning earlier, is what is the key to the success. And of course, ultimately, once your BMI goes to a different level, once it goes to a morbidly obese person, the patient is going to come to me for a surgical solution for weight loss, which will be, you know, something which will be decisive, and I'll bring the patient back to a normal BMI for his height. Okay, so normal weight for his height. That's different. That is because you came to me, but most people don't. So that is where you have to prevent it, because now there are diagnostic modalities which are available much easier than what they were available even 5 years ago. Okay, so even in Nairobi, outside the hospitals, outside the big hospitals, there are multiple diagnostic centers available. Correct me if I'm wrong, I've seen it on the streets. This was not the case 7-8 years ago when I came to Nairobi for the first time. So it means that you have all the facilities. You are going and getting yourself checked more often. But then that's not the point. You don't need to go and check yourself repeatedly to see if you're getting cancer. You need to avoid the causes that you're going to, you know, help you to go towards the cancer. That's what you're trying to first fight.
Screening.
And Dr. Rosaline, you're with me here. We are not in the habit as Kenyans of getting checked, and that's the reason why sometimes you're being told that by the time the symptoms start showing, it's almost already too late into it.
So what we are focusing right now is screening, screening. That you don't only go to your doctor when you have that cough or cold, because half the time we're doing over the counter, we go to the pharmacies. So at the pharmacies, since most of the Kenyan culture is over the pharmacy, keep a blood pressure machine there. Keep a blood glucose testing machine. That's all it requires, just to pick up, just a weighing scale, something basic. So if I put it at every government facility, at every private hospital, and actually make it free, that hey, since you're here, I'll check your pressure, I'll check your sugar, and I'll just check your waist circumference, and actually measure your body mass index, which is what he's talking about. Based on that, even as I treat you, I'll tell you these are the things. It doesn't cost much actually to just have it screened, because if you think of the cost of actually managing the problems, now we are saying that there's a rise in heart attacks, there's a rise in diabetes, there's a rise in cancer, there's a rise in everything. So Why are we waiting till the very end when when Dr. Ngugi has to come and give you a very poor prognosis? How about screen it well in advance so that you actually give us a chance to work together? Now, the reason why Dr. Palep was not getting patients before was that bariatric surgery all along was for cosmetic purposes. But what we are saying is no. The physicians and the surgeons are working together for the better good of the population. Why? If I think that diet and lifestyle is not going to be enough, my medicines are not going to be adequate, how about I send it to Dr. Palep? He reverses this process that I'm not able to with my medication, and we follow you from there. Lead a healthy lifestyle. It doesn't cost much. It's actually more expensive to go to the doctor and be checked out when you're unwell than when you're actually healthy. All we are saying is you don't have to do it every 6 months. Once a year is always enough. So what they did with the medical insurances, and we said we need to work together, was that as you get your medical insurance, how about you do some basic tests so that we know where you are. 5 years down the line, I can see where your progress, how it has been, and I can see where you're headed to. So let your doctor walk with you. So that 40 years down the line, when we can actually talk about it and you're with your grandchildren, you say, I'm alive because I took care of myself, not because the doctors told me to do this. We want the population to take that into their hands. Don't wait until it's a problem. Every time you go to that vending machine and you want to take the Coke, resist and drink water. You understand? Instead of taking that crisps, how about you just go and munch on a carrot or an apple? It's as tasty, it fills your stomach, and at the end of the day, it's not killing you, it's not blocking your arteries, it's not giving you cancer.
Dr. Jaideep, what I find fascinating is that all these things are interlinked. Before, because the viewers weren't with us when you're saying that obesity in itself causes several other cancers.
That's correct.
And is this something that is based on research? Is that what you found out?
Yes, so there are enough papers published in literature which actually say that morbid obesity can actually push forth or bring forth things like colon cancer, rectal cancer, cancer of the prostate for men, you know, ovarian and endometrial cancer for women. These are the things which are actually accelerated just because of morbid obesity. So you're already preponderant to it, but this is definitely going to get you there. Okay, so these incidences have definitely gone on the rise only because of morbid obesity. Majority of my patient population who comes to me for bariatric surgery referred by the gynecologist are usually morbidly obese ladies who have already suffered from cancer of the endometrium, that's cancer of the body of the uterus. They have already undergone the treatment by the gynec cancer surgeon. And then after 2 years of completing all their treatment, radiation, chemotherapy, everything, they're still obese. And that's when the patient is being referred to me. Take this situation 5 years before for the same patient, and had the patient come to me before that, she would probably not have landed up with the cancer in the first place.
So now here the secret is to get it early.
Absolutely, absolutely early. Because now, right now, like the doctor was saying, that the diagnostic modalities that are, the screening modalities that we are using right now are just for screening deadly diseases. All right. If we channelize those screening modalities for simple things like what she said, the body mass index, the waist circumference, just the blood pressure and the random sugar. If these 4 things are just checked routinely for every age group in the population, you will actually end up finding a lot more things than actually trying to cure the cancers. You will catch them much before.
All right. We're coming to an end on this discussion, Dr. Roselyn, but bring it home for us and break it down. So finally, what you're saying is go for screening, exercise as much as possible, and eat boiled food.
My job is done. It's not boiled food. Come on. It's the same way we tell diabetics, no oil. No, what we're saying is, by the way, you can eat, you can have your spices.
But how much is too much? Because
that is the point. If you decide that you're going to go to KFC and order a whole bucket and you're 2 of you, does that even make sense? As opposed to if you went home, had your ugali and your spinach and a little bit of meat. The problem with that is this: half your plate will be the starch, and then the vegetables are something just to add a little color to the plate. Change that proportion. half is vegetable, a quarter is the starch, a quarter is the proteins. That's it. It's really not that difficult. We are saying our lifestyle diseases are a ticking time bomb, and people need to listen to this. When we say screen, you know, it's not always that I'll give you bad news. I actually like it when people come and they say, I'm well, I've just come to say hi and do a couple of tests. It gives me so much joy when we've done the tests and we give you a clean bill of health.
Okay.
But what we are saying is, it's not just you. What are you doing to your children? When you take them into a supermarket and you keep giving them lollipops, what are we saying to the supermarkets when, as you're walking towards the checkout counter, just the other day I was there, and they're just all these lollipops and all these crisps and biscuits.
A lot of
and
candies
it's really
at the checkout
enticing.
counter.
So what we have to do is actually make the healthy foods enticing as well. But I don't have to push you. It starts with you taking care of your family, your children. We've seen the children who have childhood obesity end up with cancers when they're adults.
Oh my God.
So
let me add one small thing to you. Sorry to interrupt.
As your final remarks.
The final remark is childhood obesity is on a very tremendous rise, and now again there are published reports that childhood cancers are going on the rise, not because somebody is screening them, it's because of the obesity which is triggering them.
Ticking time
and when the last statement that you made about I have a big appetite, you have created that big appetite by stretching or allowing your stomach volume to stretch. That's true for any individual. And you have to, if you drink more liquids and more water, that appetite will shrink over a period of time.
Shrink.
Final remarks for you. Is that it? That is your advice to Kenyans?
Yes.
As we wind up?
Screen. Just screen, eat healthy, exercise. So you'll do a couple of sit-ups as we, end this segment.
Not at the end of the segment. Thank you. Thank you so much for coming in this morning. Dr. Jaydeep Palep, Director and Head of Department of Bariatric and Minimal Access Surgery at the Nanavati Super Speciality Hospital in India, and Dr. Roslyn Ngugi, diabetologist and lecturer at MKU.
Excellent.
Asante sana for coming in. Now you've had it. Eat healthy, exercise, and avoid that large appetite. We're taking a quick break here on Daybreak. When we come back, I think we'll be heading out to the Safari Rally event that's happening at the Kasarani Stadium. Asante sana. Stay with us. We're back in just a